American men are particularly impacted by poverty in terms of their employment, health, education, families, mental health, and risk of homelessness, involvement in the legal system, nutrition, social inclusion, and access to resources. Improving their lives and lowering inequities across the country depend on addressing these problems. How are American men affected by poverty? Today, we will highlight the 10 essential facts. Number 10. Employment and income disparities. Men who live in poverty have different employment and income levels, which highlight structural issues that impede upward mobility and sustain economic inequality. It is extremely difficult for many men living in poverty to find steady work that pays well and offers benefits. The traditional industries that once offered steady, well-paid employment for workers with low skill levels have declined due to structural changes in the economy, such as automation and globalization. This has a particular impact on men working in manual labor and manufacturing. The persistence of employment disparities among men living in poverty is largely due to discrimination on the basis of race, age, disability, and criminal history. Comprehensive strategies that support fair access to education and training, remove discriminatory hiring and promotion practices, and encourage the creation of exceptional jobs with competitive pay and benefits are needed to address employment and income disparities. Communities and legislators can endeavor to create an inclusive economy where all men have the chance to prosper and make significant contributions to society by tackling these systemic issues. Number 9. Healthcare access. A wide range of interrelated factors such as income levels, geographic location, insurance coverage, and cultural barriers can impact a man's ability to access healthcare when he is poor. The inability or insufficiency of health insurance for a large number of low-income men makes it challenging to pay for prescription drugs and medical care. People who live in rural or underserved urban areas may have to travel great distances to access healthcare providers due to geographic disparities in healthcare access. Healthcare utilization can also be impacted by linguistic and cultural barriers, as some men may find it difficult to communicate with healthcare providers or navigate the healthcare system. Number 8. Educational attainment. Men from backgrounds with low incomes often have fewer educational opportunities and outcomes due to poverty. Children from families with low incomes are more likely to attend underfunded schools with little access to advanced coursework, extracurricular activities, and qualified teachers. Students from families with low incomes are less likely to complete high school or pursue further education due to higher high school dropout rates. Financial obstacles including tuition, books, and living expenses can be a major obstacle for even those who choose to attend college, increasing student debt and decreasing completion rates. Number 7. Mental health struggles. Men who live in poverty frequently struggle with mental health issues, which are complicated and aggravated by the interlocking problems of financial hardship, social stigma, and restricted access to mental health resources. For men, the experience of poverty itself can be a major source of stress, anxiety, and depression as they deal with daily pressures to make ends meet, financial instability, and unemployment or underemployment. These pressures have an effect on mental health overall by causing a persistent state of psychological distress. Financial limitations, a lack of providers in underserved areas, and the stigma associated with mental illness may make it difficult for men living in poverty to get access to affordable mental health services. The way that men experience and communicate mental health issues can also be influenced by cultural norms surrounding masculinity. Men are frequently discouraged by societal norms from admitting or seeking help for emotional difficulties, which results in underdiagnosis and undertreatment of mental health conditions. This unwillingness to ask for assistance can lead to untreated illnesses that get worse over time and have a negative impact on health outcomes. A multifaceted strategy is needed to address the mental health challenges faced by men living in poverty. This strategy should include increasing access to culturally competent mental health services, incorporating mental health into primary care settings, and raising public awareness and education about mental health issues. Communities and legislators can assist men living in poverty in attaining improved mental health outcomes and increased general well-being by making mental health a public health priority and guaranteeing fair access to care. Number 6. Homelessness. Men who are homeless are significantly more likely to be poor due to a variety of circumstances, including housing affordability crises, evictions, unemployment, and a lack of supportive services. Men who are homeless frequently struggle to meet their basic needs for food, shelter, and hygiene, which leaves them feeling vulnerable and stressed out. Living on the streets or in makeshift shelters puts them more vulnerable to abuse, victimization, and issues with their physical and mental health. In order to help people regain stability and independence, addressing homelessness necessitates concerted efforts to provide affordable housing options, supportive services like healthcare and mental health treatment, and employment assistance. Number 5. Family dynamics. Economic hardship can affect men's roles as caregivers and providers as well as cause strain in family relationships. Stressors related to money can cause problems in marriage, domestic abuse, and parenting. When they don't meet the expectations of being the main provider set by society, men might feel insufficient, guilty, or ashamed. Children raised in families with low incomes may face negative consequences for their long-term life outcomes, academic performance, emotional and social development. The effects of poverty on family dynamics can be decreased by promoting healthy communication and conflict resolution techniques, strengthening family ties, and ensuring financial stability. Number 4. Criminal justice system. The criminal justice system and poverty are closely associated, with lower-income men being disproportionately represented in the jail population. When people are struggling financially, they may turn to illegal activity as a way to make ends meet or get by. Men from backgrounds of poverty who are involved in the criminal justice system encounter difficulties like restricted access to legal counsel, prejudice in sentencing, and obstacles to their successful reintegration into society after release. Opportunities for rehabilitation, employment, and community integration are limited by the cycle of poverty and incarceration, which also maintains social and economic exclusion. Number 3. Nutrition and food insecurity. A major problem for men living in poverty is food insecurity, which is defined as having insufficient access to cheap, wholesome food. People with low incomes are frequently forced to eat cheap, high-calorie, low-nutrient foods, which raises the prevalence of diseases associated with diets like diabetes, obesity, and cardiovascular disease. When people are unable to afford enough food for themselves and their families, they become more stressed and anxious, causing an adverse effect on their mental health. To overcome food insecurity, comprehensive strategies are needed, such as enhancing the availability of reasonably priced and rich in nutrients food options, expanding the eligibility pool for nutrition assistance programs, and handling structural disparities in food distribution and availability. Number 2. Social exclusion. Men who live in poverty are significantly impacted by the complex phenomenon of social exclusion, which shapes their experiences of marginalization and reduces their chances of engaging in social activities and achieving economic mobility. Financial hardship or feelings of shame and stigma related to one's socioeconomic status can cause people to retreat from social interactions, which frequently results in social isolation. Men who live in poverty may be excluded from social networks, cultural events, and community activities, all of which are essential for fostering relationships, gaining access to resources, and strengthening social support. Furthermore, social exclusion can prolong poverty cycles by restricting opportunities for work and education. Socially excluded men may not have the social networks needed to land stable jobs at living wages, or they may experience discrimination during the hiring process. Comprehensive approaches that encourage community involvement, support social inclusion, and lower obstacles to participation for men living in poverty are needed to address social exclusion. Moreover, policies that support mental health services, expand access to healthcare and education, and encourage economic empowerment can help men living in poverty feel better overall and less affected by social exclusion. Number 1. Barriers to social services. For men living in poverty, obstacles to obtaining social services pose serious problems since they frequently raise their financial difficulties and make it more difficult for them to meet their basic needs. These obstacles can take many different forms, such as complicated bureaucracy, strict eligibility requirements, and insufficient service availability. Difficult bureaucratic obstacles like lengthy documentation requirements and difficult application procedures can discourage people from asking for help. Many men living in poverty might not have the means or expertise to properly navigate these systems, which can cause them to become frustrated and even less likely to use essential services like healthcare, nutrition programs, housing assistance, and unemployment benefits. Communities and policymakers can support men living in poverty more effectively, improve their well-being, and create pathways to social inclusion and economic stability by removing these obstacles. It is essential to understand and manage the significant effects of poverty on American men in order to promote fairness and enhance living standards. We can try to create a more equitable society for all by addressing these issues. If you find our video informative, then hit the like button and subscribe for more content.